Hi, I'm Colleen. I'm a family nurse practitioner and owner of Serene Primary Care. Welcome to Menopause Mondays. We are taking a step-by-step approach to understanding menopause. And today we are going to break down the symptoms and what is perimenopause, also known as the menopause transition. This is a natural phase of life that can bring about a lot of changes. Understanding what's happening can make it easier to manage and make it an empowering time of your life. The menopause transition begins when you first start noticing changes to your menstrual cycle, and it lasts until it's been 12 consecutive months of no menstrual cycle. The menopause transition typically spans 2 stages. The early transition years is marked by when the menstrual cycles start to break their typical pattern. These menstrual cycles tend to be heavier and closer together. During this time, it's also typical to experience more breast tenderness, irritability, and mood changes. The late transition years begins when you've had cycles that are more than 60 days apart. During this time, the estrogen drop is significant. Symptoms like anxiety and mood vulnerability really intensify. Many of the symptoms that we associate with perimenopause are caused by hormonal fluctuations. For instance, early transition symptoms are driven by stacked short cycles, which means the estrogen levels are actually building up. The late transition symptoms are marked by longer gaps between periods and much lower estrogen levels. These symptoms might include hot flashes, night sweats, irritability, mood vulnerability, and brain fog. It is worth noting that women with past trauma or high stress, known as ACEs, adverse childhood experiences, may find these years particularly challenging. Treatment for the menopause transition focuses primarily on your symptoms and perhaps even clamping down on those transitions in hormones. The treatment of menopause transition should really focus on the woman and her symptoms. Decisions can be made with input from a trusted healthcare provider. Here are some options for treatment during the menopause transition. Continuous birth control can provide stability with boring hormone levels that smooth the ride. Hormone therapy can be started with patches or pills, but dosing levels really need to be tailorized. Starting too low may not always be effective, but it may prevent adverse effects. Some women benefit from IUDs with progesterone in them. Even though this is off-label, it is a way to manage symptoms and decrease bleeding. There are also many non-hormone options for treatment during the menopause transition. Oxybutynin is a non-hormone option that decreases sweating. Venlafaxine is an SNRI that also helps with hot flashes and may even help with mood. Medications like gabapentin can be used for sleep. The basic message is that there's plenty of options, and working with a trusted healthcare provider will help you find the best treatment for your bothersome symptoms. Every woman's experience with the menopause transition is unique, but here are a few universal truths. It's a natural phase, not a disease, but it still can be very challenging. Symptoms should be validated, and most can be treated. Shared decision-making with your healthcare provider is the key to finding the best path forward for you. The menopause transition is an opportunity to learn more about your body and prioritize your health. If this video was helpful, stay tuned for more in our step-by-step menopause series. Thanks for watching, and I'll see you on the next one.